Hello, everyone. I'm Eliza. I am a part of Group 7 in Intro to Health Administration 312 with Dr. Saunders. We're presenting to you HOC analysis for All-Inclusive Community Health Center, presented by Carla, Eliza, Quinn, Iridian, and Lena. Introduction and overview. To understand a healthcare organization's purpose and importance relies on the healthcare provider's relationship with their patients, which ensures that there's trust built, improving adherence and the better outcome with the patient's health. All-Inclusive Community Health Center, AICHC, is an organization that believes in providing for the underserved communities in the Los Angeles County and San Fernando County. Furthermore, All-Inclusive Community Health Service promotes growth in healthcare access and social services, which allows communities to further their education in their health. In this video, which was a promotional video done by All-Inclusive Community Health Center, shows that they cater to a diverse community and population, regardless of your income, your health provider, your health insurance. They just want to set a big example of what they, as an organization, stand for, which is all-inclusive care for all.
Kindness, caring, compassion, and individual attention. This is our promise to our community. Despite your low income or immigration status, our highly trained team, nurses and doctors, will provide you with high-quality health care at no cost or low cost. The only priority of our medical center is the health of our community. Let All-Inclusive Community Health Center become your medical home.
This video shows that their mission is to give everyone who the ability to get health services that they need, regardless of what your issue may be, regardless of your income, regardless of your racial profile. There is no discrimination for anybody.
Hello, my name is Carla and I will be talking about the external environment. So let's talk about the market. All-Inclusive Community Healthcare is unique because it is a nonprofit health organization which services include healthcare services to the vulnerable and unserved populations, regardless of their ability to pay for care. All-Inclusive Community Healthcare offers a range of services, but not limited to dispensary, such as giving free medication, primary care, both for internal medicine and family care medicine, which means that they do treat children up to the age of 18 before they're considered adults. All-Inclusive Community Healthcare Center also offers HIV and STD testing. So people that might feel that they might have HIV or a type of STD can feel comfortable that they can go to this center and get very low cost services. All-Inclusive Community Healthcare also offers behavioral health services for mental and substance abuse. They do have trained and certified staff that can serve with that population. In addition, they also have chronic disease management in areas such as diabetes, infectious disease, hypertension, anxiety, and depression, to name a few. They also offer great healthcare screenings, such as in diabetes, hypertension, prostate cancer, smoking cessation, and much more. All-Inclusive Community Healthcare also offers women's health, such as pap smears, breast exams, pregnancy testing, and can even refer to outpatient services for OBGYN care. Now, in continuation of the external environment, our team discovered that there are many different types of healthcare organizations, different sectors, and different backgrounds. So near all-inclusive, we discovered that in the Northridge facility, they have 3 nearby hospitals, such as the VA, which caters to veterans primarily. They also have a hospital named Northridge, which is part of Dignity Health. It is a trauma center and a full functional ER. They also have Providence Holy Cross Medical Center, which again is a trauma center and a full service hospital. However, you know, in addition to all those centers, we did discover that they have hospice agencies, a lot of dental agencies, specialty care, including primary care, but one prominent medical organization, which is pretty close in competitor to the immediate geography, would be Regal Medical Group. The organization is a Medical Independent Physician Association, also known as an IPA, and they are a for-profit organization. Although Regal is a medical group that doesn't treat patients currently at their facility, as they are a corporate office, they do have the right to turn away members if they do not have the right coverage, such as HMO. Because patients prefer variety when it comes to healthcare, All-Inclusive Community Healthcare Center offers a patient-centered medical home care model, which is very patient-focused. What that means is the staff and all the medical assistants, from nursing to physicians, perhaps specialists, they all are in this integrated care system in which they track all of the care coordination that goes behind the patient's care. Everything that the patient receives is documented, discussed through possibly interdisciplinary rounds, and it really emphasizes on the patient education and the preventative care, which ultimately provides better health outcomes. Patients can visit their local all-inclusive community health center, as they know they will not be turned away from seeking medical attention when they need it most. Since All-Inclusive Community Healthcare Center treats all ages, it makes it an ideal facility for families to visit. And right now, I'm going to be discussing, in addition to what we've learned about the external environment, we're going to focus on the community demographic and the needs. So our team did some research, and through the census, according to the Census Reporter in Northridge, California, in 2019, the population was 180,054. In the Los Angeles County, the North region in LA City, which is considered the Northwest Chatsworth and Porter Ranch region area, the average age was 42.3 in 2019, with 52% of the population being female. The per capita income in 2019 was $41,580, and the minimum household income was $92,457. Poverty was at 9.1%, and 89.7% of the population held a high school diploma or higher, and 40.9% held a bachelor degree or higher. All-Inclusive Community Healthcare offers women health services, which is beneficial for the female population in the area in Northridge, as the healthcare services are affordable and easily accessible at their facility.
Ensure accreditations, collaborations, and finance. Licensure. According to the company website, on September 25th, 2017, All-Inclusive Community Health Center was awarded a 3-year recognition by the National Committee for Quality Assurance for the Patient Centered Medical Home Program. All Inclusive Community Health Center is a quality leader recognized by the Federal Health Resources and Human Service Administration from 2017 to present. Additionally, All Inclusive Community Health Center has also been recognized as the National Quality Leaders in 2019 and 2020 for diabetes health and heart health. These recognitions demonstrate that All Inclusive Community Health Center has the right tools, systems, and resources to provide patients with the right care. Collaborations. In order to provide a full range of diagnostic, treatment, care, and healthcare services for the San Fernando Valley region, All Inclusive Community Health Center has an affiliation with Providence St. Joseph Medical Center, which employs over 2,500 people, has over 700 physicians, and nearly 300 volunteers. Providence St. Joseph Medical Center has a huge emergency services program, cancer program, heart and vascular care, as well as women's health. They are also partner with Covered California and have certified enrollment counselors who can help guide through the process of eligibility and enrollment. Between All Inclusive Community Health Center and Providence St. Joseph Medical Center, they provide a well-rounded variety of healthcare services. Areas for improvement would be expanding their locations in order to cover more networks in the San Fernando Valley area. All Inclusive Community Health Center could also have in-house radiology services and hold health fairs / promotions to educate the community on preventative care services. Finance. All Inclusive Community Health Center accepts all major insurance types, such as Anthem Blue Cross, Blue Shield of California, HealthNet, Covered California Exchange, and government health insurance, which includes Medicaid and Medicare. The organizations also offered a sliding fee scale, which allows for discounts depending on family size and income. All Inclusive Community Health Center has made it a point to let the community know that no matter your finance status, All Inclusive Community Center allows for anyone to be treated without being discriminated away.
So previously, Iridian and Carla had just gone over the external environment, and now I will be going over the internal environment of All Inclusive Community Health Center. So digging a little deeper into what type of health organization All Inclusive Community Health Center is, we learned that they are a nonprofit community health center whose mission is to promote the physical and mental well-being of the community, which in this case, community to them also includes the underserved populations in the community of Los Angeles County. Their goal is to increase access to healthcare and other social services for all community residents, including the underserved, vulnerable, and special populations, and by improving the environmental and social conditions that might affect the patients in their communities. So they do this by providing patient-centered care and coordinate patient centers across the broader healthcare systems. So this includes hospitals, specialty care, home healthcare, and community services. And through some basic research on their website, we learned that All Inclusive Community Health Center, being an organization that focuses on providing for the underserved and vulnerable people, have a few important values that we will discuss right now. So the first one is commitment, which they described it as being committed to their patients as well as the community. Respect, valuing others regardless of race, culture, personal qualities. In Next one is integrity, so providing excellent service with pride and honesty. Communication, so practicing effective communication skills. Mentoring, teamwork, and finally, compassion, so recognizing that each client is unique. So moving on to the structure of the organization, I will go over the size, population mix, services that they offer, and the volume of services they provide. Although there were no specific information on the facility in Northridge, I was able to find a few information on their main facility in Burbank. What I found was that All-Inclusive Community Health Center is 2,500 square feet and a newly renovated facility. And as a matter of policy, the services they are providing is open access, is open to all families and individuals seeking health services. So regardless of race, group affiliation, age, gender, or the patient's ability to pay, services will be provided to these families. So what are some of these services that they provide? Some of the services include behavioral health services, chronic disease management, family planning, health education outreach, homeless services, outpatient substance abuse treatment, pediatric care, transportation, and women's health, all of which specially focuses on responding to the unmet health needs of the community's underserved residents. And it's unclear the exact volume of services they provide. However, through research, find out that their goal in 2014 was to expand the availability of affordable healthcare services to over 4,000 patients in 14,000 visits, which I'm sure this goal has been met and exceeded as of 2020. So moving on to the human resources of the organization, All-Inclusive Community Health Center has been recognized by the Federal Health Services, as stated earlier, and which this is an agency of the U.S. Department of Health and Human Services, is a primary federal agency for providing healthcare to people who are geographically isolated, economically or medically vulnerable. They are affiliated with Providence St. Joseph Medical Center. Their facility has a rough estimate of 51 to 200 employees, and their staffing includes general and internal medicine providers, a board certified family practitioner, nurse practitioner, case manager, certified medical assistants who have extensive clinical knowledge and experience in serving the underserved population, and a management team with over 35 years of experience.
Organizational analysis. This is analysis that our group did and what we think their strengths, weaknesses, opportunities, and threats are. Strengths. The organization being able to provide a variety of health service for underserved communities at a low cost. This is one thing they definitely push for as we researched and also shown in their TV ad. This is also a nonprofit organization that services more uninsured patients because they do have the funds to do that. Weaknesses. Patients not being able to thoroughly understand the services that are provided if looking further information via the internet. As of right now, COVID has pushed everyone digitally and more people are staying home. So if you're able to cater to those people by having everything on your website, it is easier to communicate what your company means, and it will save the organization time to be on the phone with different patients when they can just look it up online. Another weakness is the hours of operations. They're very limited. On Monday through Friday, 8 a.m. to 5 p.m., they are open. On Saturdays, bi-weekly, they are open from 9 a.m. to 2 p.m. And on Sundays, they're closed. Why is this a weakness? Because when you are open more hours and more days, you're able to cater to more patients, especially because they cater to the underserved communities. They can be going into other clinics paying for these services when all-inclusive community health center can provide it for free. Opportunities. The organization reaching out to communities outside of the San Fernando Valley is an opportunity to expand their services to other people. As I said before, Los Angeles County is part of the network they're expanding to, and they are going to be able to expand to even more networks in the coming years. Threats. A threat to this organization would be other clinics outperforming their services. This goes back to hours of operations, because the more hours you're open, the more you're able to provide services. Also, they can provide other services like local hospitals can outperform them because they are able to provide services that this organization does not have in-house.
For this presentation, a interview was not, we were not able to get an interview, possibly due to COVID, and we were not able to schedule an interview with someone within the All-Inclusive Community Health Center after multiple attempts of outreaching to the organization with unfortunately no response. However, we did come up with a series of 5 questions that we would have liked to have asked our interviewee. The 5 questions include: 1, what are some of the strengths of this organization and how do they benefit the patients? 2, could you describe a weakness that hinders the organization from providing better care? 3, do you find that there is a strong sense of leadership roles that gives organizational hierarchy and basis for decision-making within the organization? 4, how many employees does All-Inclusive Community Health Center have currently? 5, how does the organization plan to expand its services to other people in the communities to help further the mission that was proposed? In conclusion, how might the organization's environment change in the future? The organization's environment may change in the future regarding who they care for. They may start branching out to other demographics for their patient care, and change in management team members, meaning who is part of their team, who is part of the mission, who is in charge of the organization. If they remain nonprofit, they may change to become a profit organization, or they may not, which would obviously affect a big portion of their demographic for patients. What services they offer, branching out with more services as well than what they already provide, and their external environments around them may alter as well, such as other organizations / companies may begin to populate more within a certain distance of them, creating some competition. How should the organization adapt? Well, as we learned within this course, there are essential factors that are important in achieving success, as well as adapting to change, which would include teamwork, communication, setting goals in order to achieve success. Other observations: overall, regardless of what specific organization, healthcare has a purpose of providing needed health services to its members of different communities and obtaining goals for the present and future success.
So this is the end of our presentation. Unfortunately, due to COVID, we won't be able to take questions, but I just wanted to say thank you for listening to our presentation, and you guys have a great night.